You arrive at the scene where a 40-year-old male is complaining of severe chest pain radiating to his left arm. He is pale and diaphoretic. What is your first action? A. Give him water to calm him down. B. Obtain a detailed past medical history. C. Administer high-flow oxygen and prepare for transport. D. Delay transport until 12-lead ECG is complete. Answer: C. In suspected cardiac emergencies, immediate oxygen administration and rapid transport are priorities. Detailed history and ECG can be done en route. An unresponsive adult patient has no pulse and is not breathing. What is the correct compression to ventilation ratio for single rescuer CPR? A. 15:2. B. 30:2. C. 5:1. D. 20:2. Answer: B. The American Heart Association, AHA, recommends a 30:2 ratio for single rescuer CPR in adults to maintain adequate perfusion and ventilation. You are treating a burn patient with blistered, moist skin over the forearm. This burn should be classified as A. First degree. B. Second degree, partial thickness. C. Third degree, full thickness. D. Superficial thermal burn. Answer: B. Second-degree burns involve the epidermis and part of the dermis, causing pain, blisters, and a moist, red appearance. During a motor vehicle accident, a patient is found with paradoxical chest movement. This is most consistent with A. Pneumothorax. B. Flail chest. C. Cardiac tamponade. D. Tension pneumothorax. Answer: B. A flail chest occurs when multiple adjacent ribs are fractured in more than one place, leading to paradoxical chest motion during breathing. When approaching a multi-casualty incident, the EMT's first priority is to A. Begin triaging victims immediately. B. Request additional resources and ensure scene safety. C. Transport the most critical patient. D. Provide first aid to the closest patient. Answer: B. Scene safety and calling for backup take priority before patient care to avoid creating more casualties and to manage resources effectively. A patient with severe asthma is wheezing and struggling to breathe. What is the EMT's primary treatment? A. Encourage coughing. B. Administer a bronchodilator via prescribed inhaler. C. Perform abdominal thrusts. D. Apply a cervical collar. Answer: B. If the patient has a prescribed bronchodilator inhaler, EMTs may assist with its use to relieve bronchospasm and improve ventilation. What is the most reliable sign of cardiac arrest in an adult? A. Absence of breathing. B. Unresponsiveness. C. No carotid pulse. D. Cyanosis of lips. Answer: C. The absence of a carotid pulse confirms cardiac arrest, guiding the EMT to begin immediate CPR. When using a bag valve mask, BVM, to ventilate a patient, what is the most common error? A. Not enough oxygen flow. B. Poor mask seal leading to air leakage. C. Overventilating with too many breaths. D. Forgetting to attach the oxygen tubing. Answer: B. Inadequate mask seal causes air to escape, reducing effective ventilation and oxygen delivery. Proper positioning and technique are essential. You arrive at a home where a patient with diabetes is unresponsive and cool to touch. A glucometer reading shows 40 milligrams per deciliter. What is the best treatment? A. Give oral glucose immediately. B. Start CPR. C. Position in recovery position and transport. D. If conscious, give oral glucose. If unconscious, transport for 4-dextrose. Answer: D. Oral glucose can only be given to conscious patients who can swallow, otherwise, for dextrose or IM glucagon at the hospital is necessary. A patient with a suspected spinal injury begins vomiting. The EMT should A. Tilt the head back. B. Turn the patient's whole body as a unit onto their side. C. Remove the cervical collar. D. Apply suction without repositioning. Answer B. To prevent aspiration, log roll the patient while maintaining spinal alignment. Suction alone cannot clear large amounts of vomitus safely. Which of the following patients requires high-flow oxygen via non-rebreather mask? A. Alert patient with mild shortness of breath. B. COPD patient with stable oxygen saturation. C. Unresponsive patient with adequate respirations. D. Shock patient with pale, clammy skin. Answer D. Hypoperfusion and shock cause tissue hypoxia. High-flow oxygen improves perfusion until definitive care is available. What is the first step in using an automated external defibrillator, AED? A. Press the shock button. B. Apply the electrode pads. C. Turn on the AED. D. Check for a pulse. Answer C. Powering on the AED allows voice prompts to guide rescuers step by step. Pads are applied after turning it on. A patient with a penetrating chest wound is having difficulty breathing. What is the correct EMT action? A. Seal the wound on all sides with gauze. B. Apply an occlusive dressing sealed on 3 sides. C. Remove any penetrating object. D. Perform abdominal thrusts. Answer B. Sealing the wound on 3 sides prevents air entry while allowing trapped air to escape, reducing the risk of tension pneumothorax. You suspect a stroke in an elderly patient. The FAST assessment includes all except A. Face drooping. B. Arm weakness. C. Speech difficulty. D. Shortness of breath. Answer D. FAST stands for face, arm, speech, time, key indicators of a stroke. Shortness of breath is not part of the stroke scale. During childbirth, the umbilical cord is wrapped around the infant's neck. You should first A. Pull the cord to loosen it. B. Clamp and cut immediately. C. Attempt to gently slip the cord over the baby's head. D. Delay delivery until paramedics arrive. Answer C. If the cord is loose, gently slip it over the baby's head. If tight, clamp and cut between the clamps before the shoulders deliver. The proper rate of compressions for adult CPR is A. 80 to 100 per minute. B. 100 to 120 per minute. C. 120 to 150 per minute. D. 60 to 80 per minute. Answer B. The AHA recommends 100 to 120 compressions per minute for effective circulation without causing fatigue or trauma. A patient is hyperventilating due to anxiety. You should A. Have them breathe into a paper bag. B. Reassure and coach slow, regular breaths. C. Apply high-flow oxygen. D. Use positive pressure ventilation. Answer B. Reassurance and guided breathing help normalize CO2 levels. Paper bags are no longer recommended due to hypoxia risk. Which type of bleeding is characterized by bright red, spurting blood? A. Capillary bleeding. B. Venous bleeding. C. Arterial bleeding. D. Internal bleeding. Answer C. Arterial bleeding spurts with each heartbeat due to high pressure and requires immediate direct pressure to control. In which situation should a nasopharyngeal airway, NPA, not be used? A. Unconscious patient. B. Facial trauma with suspected skull fracture. C. Patient with intact gag reflex. D. Patient in respiratory distress. Answer B. Inserting an NPA in a patient with suspected skull fracture may cause the tube to enter the cranial cavity, worsening injury. A patient with heat stroke will present with A. Moist skin and shivering. B. Hot, dry skin and altered mental status. C. Normal temperature and weakness. D. Sweating and pale skin. Answer B. Heat stroke involves failure of thermoregulation, sweating stops, the skin becomes dry, and confusion or unconsciousness develops. When performing a primary survey, which step should the EMT take first? A. Assess airway. B. Check for major bleeding. C. Evaluate level of consciousness. D. Inspect for deformities. Answer C. The first step in any primary assessment is determining responsiveness, AVPU, before airway or bleeding management. A 3-year-old child has a respiratory rate of 10 breaths per minute. What should you do first? A. Provide ventilations using BVM. B. Observe for 1 minute more. C. Administer oxygen via nasal cannula. D. Begin chest compressions immediately. Answer A. A respiratory rate below normal in a child signals respiratory failure. Immediate assisted ventilations are necessary. Which of the following best describes shock? A. Collapse from dehydration. B. Failure of circulatory system to deliver oxygen. C. Emotional reaction to trauma. D. Cardiac arrhythmia. Answer B. Shock, hypoperfusion, occurs when blood flow and oxygen delivery are insufficient to meet tissue demands. An elderly patient suddenly faints while standing. What is your first step? A. Obtain vital signs. B. Open airway and check breathing. C. Raise legs and provide oxygen. D. Give sugar. Answer B. Always check airway and breathing in a collapsed patient before interventions to rule out cardiac arrest or respiratory failure. What is the correct treatment for a chemical burn to the eye? A. Cover the eye with a dry sterile dressing. B. Flush with water for at least 20 minutes. C. Apply ointment. D. Use an eye patch. Answer B. Immediate irrigation with copious water for 15 to 20 minutes reduces chemical damage and improves outcomes. Do not cover or patch.